News 13, your main source for news.
Well, a groundbreaking study recently revealed a surprising treatment for type 2 diabetes. It got a lot of attention.
Yeah, News 13's Kim Block joins us with tonight's Helpline and how the study really shook things up, Kim.
Well, Adrian and Jeff, the study by the Cleveland Clinic and published in the New England Journal of Medicine found that gastric bypass surgery is more effective at treating type 2 diabetes than medication alone. Now, while you take a second to absorb that, I want to tell you the phone number again that you can call tonight. We have a health line going on with experts on hand from Central Maine Medical Center to talk about gastric bypass surgery, 1-877-494-6308, or you can chat live online at WGME.com. In the meantime, I want you to meet Gil Michaud, who recently had the surgery. Gil also had a diabetes-related stroke, and his neurologist told him he better do something or he might not be so lucky next time. Michaud had gastric bypass surgery about 2.5 years ago, and guess what?
I have no signs of diabetes anymore. I'm on no medication for my diabetes. I used to be on 4 different medications, and I now am on none. So it has been phenomenal.
Gil says he actually left the hospital. Look at these before and after pictures, by the way. Those were the clothes he wore before the surgery. He left the hospital the day after the surgery without needing any diabetes meds. He stopped needing blood pressure medication soon afterward. Now, joining me to talk about this very interesting development, although it's not necessarily news to him, is Dr. Jamie Loggins, who's the chief of surgery at CMMC and the head of the department here. Now, this is something that you've suspected and known and seen in your patients, but it's been validated now by this study.
Absolutely. It's, Gil's story is not one of those outliers. It's really the common thing that we see all the time. As bariatric surgeons, we've been observing for a long time diabetes is getting better. What the recent literature really showed is they went head-to-head to prospectively see what happens if you just use surgery against conventional medical therapy alone and what happens to the patients. But the most interesting thing about it, Kim, is they were looking at patients who weren't suffering from severe obesity. It was patients who suffered from just milder obesity, because the observations that we were seeing on the diabetes effects were so strong and so reproducible. They wanted to see, does it apply to a broader category of patients? Basically taking us down to ask the question, is diabetes becoming maybe a surgical disease? And it's a multifactorial problem, and that's just one component, but the study did show that there was almost 4 times greater chance of a patient meeting established end goals for their diabetes management when they had surgery compared to medicine alone.
All right, well, it's something we're going to continue to follow because it could change the course of treatment, of course. Now, before we go, we're getting a lot of questions from people wondering if they are a candidate for this surgery.
Sure.
Generally, there are some guidelines, and they have to do with body mass index.
Right. Mostly, it's the National Institutes of Health criteria that most insurance carriers will follow. So if somebody has a body mass index, which is simply your weight relative to your height, of 35 or greater with medical problems related to their obesity, they may be a candidate. Many times if the BMI is 40 or greater, that in and of itself makes that a valid option for that patient.
All right, Jamie, we have a picture real quick here. We can't really explain it in too much detail, but that's how you bypass, and the stomach that originally is this size is going to wind up about that size.
Real
which is
quickly,
about the size
you
of
see,
a plum.
a new small stomach.
All right, and so if you have more questions, and we're sure you do, we do have the panel of experts here. You can call our toll-free Healthline hotline there. You see it there, or you can continue to call in your questions online, and we want to thank Dr. Steve Bang, who is answering all the questions on our online chat tonight, and all the staff here at the Bariatric Surgery Center at CMMC. Back to you, Jeff and Adrian.
All right, interesting stuff, Kim. Thanks.